Skin rejuvenation is probably one of the lengthiest conversations we have here at Cosmetic Skin and Laser Center. Of course, one of the most common desires we hear from clients is, I just want my skin to look better. And one of the reasons the conversation is so long is because the options we have to improve your skin are so broad. When I'm saying skin rejuvenation, I'm not talking about sinking or sagging skin. We're talking about dull, blotchy, hyperpigmented, red, dry, and crepey skin. All of these are common complaints from our clients. 3 things happen to aging skin. First of all, our dead top layer of skin starts to build up. These outer layers of the skin look dull, like that yucky top layer of an onion. Secondly, the years of sun damage start to add up and cause broken blood vessels or brown spots or crepiness or all 3. Even people who have never tanned will still have some cumulative damage just from driving in the car. Thirdly, our skin doesn't turn over and produce new skin like it used to. It gets lazy. And just like keeping your body in shape, you have to work harder to maintain your skin, let alone improve it. So how do we fix it? I'll tell you right now, if I didn't have to worry about your budget or you having social downtime, 9 out of 10 times I'd recommend the FX laser. This is the Mercedes of skin treatments. The UltraPulse FX laser was developed from the old CO2 laser peel, which had excellent results. But it was really high risk for hypopigmentation, waxy looking skin, and a line right here where the laser stopped. It was done in the operating room and had weeks to months of recovery. The new UltraPulse FX laser is a CO2 laser, but it's pixelated, so it resurfaces your skin in tiny dots like this. The FX laser takes 5 to 10 years off your face by reducing lines, brightening skin, fading brown spots, and even giving some skin tightening. The laser is offered at 3 different depths and densities, and the results are most dramatic, obviously, with the most aggressive treatment. This laser does require you to hide away for 5 days with Vaseline smeared all over your face. So it's a time and social commitment on your part, but you won't be disappointed in the results. If you just can't handle the downtime of the FX laser, but don't mind spending $1,800 or so, I'd recommend you do a series of treatments, alternating intense pulse light with microdermabrasion or alpha hydroxy peels. This series of 10 treatments will reduce any capillaries or broken blood vessels you have. It'll fade your brown spots, and it will improve the texture of your skin. It's just not quite as dramatic as the FX, although it actually works better on redness. We've been offering this series for years, and lots of clients repeat the series every year because their skin is so much more radiant and even-toned. There's no downtime with any of these visits. Very little risk of a blister or mark or anything like that after the treatment. And each visit only takes about a half hour. They're the perfect lunchtime treatments and a great alternative if you don't want the downtime of the FX. If we're avoiding laser or light-based treatments due to cost, then usually we start with some type of peel along with prescription skincare. Chemical and physical peels are all really cost-effective. They only cost about $100 to $300. And of course, we can give you specific pricing. We do all sorts of peels: lactic, glycolic, beta, salicylic, microdermabrasion, alpha hydroxy, and TCA peels. They're all part of the program here. Honestly, they're all really similar as far as results go, but definitely certain skin types respond better to one over the other. For instance, an acne-prone patient will generally love salicylic peels. Patients noticing just mild aging changes will appreciate glycolic, and patients who want instant results like microdermabrasion. Patients with rosacea generally only tolerate glycolic, if any peels at all. They're all priced very similarly, so we can help you. If you do a series of these peels or exfoliation treatments and space the treatments every week or 2, you'll generally notice your skin looking brighter and more even-toned within 4 to 6 weeks. The results are more temporary than, let's say, the FX laser, which can last for years. But they certainly can be maintained longer with skincare products like Retin-A, SPF, and antioxidants. As a matter of fact, all of these treatments will have the longest lasting results when you commit to a regular skincare program, and maintenance treatments too. Once a year maintenance is better than nothing, but a good majority of our patients do some sort of maintenance, intense pulse light treatment, or peel every 6 to 8 weeks. Of course, there's one final option, and that's just to use a combination of cosmeceutical and prescription skincare. With the right program, you can fade some of those less resistant sunspots, smooth out your skin, and increase your radiance in your skin. It'll probably take a few months, but the results will come with time. I can't emphasize enough that what you do at home is just as important or more important than what you do here. A good skincare program involves 2 to 3 steps in the morning and 2 to 3 steps in the evening. It'll protect you from sunburns, from chronic sun exposure, it reverses free radicals, and it stimulates skin turnover and exfoliation. As I said in the beginning, skin rejuvenation is complicated because there are so many options. I like to draw the parallel between skin rejuvenation programs and working out. Whether you do aerobics, run, walk, or Pilates, yoga, or spinning, well, it's all good. And generally speaking, more is better, but anything is better than nothing. And just like working out, it's not uncommon to change up our routine every once in a while, depending on the issues you are currently struggling with. So don't delay. Let's get started with something soon, and we can build from there.